Hello, my name is Jeremy. I'm a paramedic and current nursing student, and welcome to The Real Truth. Like, comment, and subscribe, and hit the notification bell for future videos. And I would like to start off by basically saying thank you. We're approaching 100 subscribers before uploading this video. And let's go ahead and get started with the video. Alright, so in this video I'm going to go over 3 misconceptions coming from both professions, the paramedic point of view and the nursing point of view. First point, coming from the paramedic's point of view, when the nurse unnecessarily have paramedics or firefighters wait for an hour for a bed when it's obvious that the ER is empty. Okay, so first off I want to start off by saying, come on, we're all professionals. That's just straight up disrespectful. We're not dumb. We can actually see if you're busy or not. We can see if you're pretty much on your phone. We can see if you're pretty much just having like your girl time or you're having a guy time, whatever, depending on what type of department, because they are male nurses that also run ERs. Just respect the profession, bro. Like we're here. Nobody, we want to get in, drop off the patient and get out and stuff. And like, to be honest, we'll probably just chill in the EMS room afterwards anyway. But they do a report so we can just move on about a day and have a smooth shift as possible, you know? Okay, so now it's going to be the one coming from the nurse's point of view. On the nurse's side, the paramedic's point of view of nurses is they pretty much just do what the doctor tells them. To respect the profession, that's simply not true. Okay, so like it's simply not true for a number of reasons. For one, yes, there is orders that we can basically that nurses can basically do, and yes, there is more freedom on the paramedic side. But there's different professions where like you have to do critical thinking, and the nurses pretty much working on their own. For one example, let's go with community health nursing. Community health as a whole has a shortage, and there is urban neighborhoods and there's rural areas. So when there's rural areas, it's less likely for farmers or people to actually have healthcare because the hospital is probably like an hour or two away. So to fix that issue, they send nurses or whatever, doctors or whatever's available at the staff, because they're short staffed, to go over there, and they'll draw labs, they'll do basic assessments, they'll give vaccines, they'll educate them about nutrition, they'll pretty much check and see their individual situation and go from there. And that's just one example. They also do that with home health care or hospice, and there's time spans where they have to basically manage drips or basically you have to manage like a peg tube or stuff right there. So there's more things. Yes, there is a guideline for them to follow with nurses, with doctors, but in those particular cases they're kind of acting like like a paramedic would independently, and if there's a complication they would radio it in. It's pretty much similar to the complications that we would run across in the field. I understand in the fields at times ours is broader, but you can't basically say that it's just like, hey, you do what the doctor tells you, because there's plenty of jobs with nurses where it's on them. Okay, so back to the paramedic's point of view. The paramedic side, disrespect from the nurses. Okay, so let's face the facts. Some nurses are just have a stick up their ass, and like they will make it seem like that medics are below them, that they're so much superior to them in a different knowledge aspect, and what I got to say to that is pretty stupid, because like we work as a team. From the aspect of finding the patient who's having chest pain, and then basically putting a 12 lead and seeing that they have a STEMI alert, basically that they're having a pending heart attack, the arteries inside of the heart is basically blocked. So from the paramedic pretty much getting an IV, getting them on oxygen, it probably giving them like vanilla morphine for the pain, and pretty much just hightailing it to the hospital and managing the vital signs and stuff going from there, and radioing it in so they can activate the necessary services. That's our role. Nurses, I understand they have a broad scale of it, but you have to respect the aspect of being a part of a team. It's just not cool whatsoever to have it nurses basically in some cases feel as though that they're above anyone. Like like let's be real for a second right here. Like, yeah, we're all part of a team, but which one's really wiping ass and which one's not? So, hey, if you want to go with disrespect, it can be disrespectful towards you. Respect everybody. Okay, so let's go back to the nurses side. When paramedics have a critical patient and don't radio in. Okay, so me being a paramedic on the field, I can get, I get it. Like, sometimes you're pumping in the chest and you come in the ER and you just don't have enough time and stuff because it was like down the street. I get it. Normal protocol is you're supposed to call it in so they can have the additional resources ready and stuff. But for the nurses, but like if you have enough time to basically get the patient in and you have enough time to radio in, do it. It's part of your protocols. There's no excuse, because if you're looking at it from a nurse's perspective, you're basically, okay, I finally got to sit down for a second to grab a bite to eat. And then, like, you know, you're sitting right next to the radio, and then you see somebody pumping in the chest, and you're like, what the fuck? I could have had resources available to basically do it. Now I gotta scramble around. Now I gotta find a doctor. Now I gotta call this right here. Make their life a lot easier. Radio it in, bro. Alright. And now that we're on the subject of radios, let's go back to the paramedic side. When the ER nurses don't take the radio seriously, there's been a number of times where, like, okay, you'll radio it in and stuff, and they're like right next to the radio. It's like, okay, come on in and stuff, right? And they're really not paying attention to the radio. But me as a medic, if I have a STEMI alert, which means you're having a heart attack, or you're having a sepsis alert, meaning you have like an infection that's taken over your body that's life-threatening, or if you have a stroke alert, when there's blockage in the brain that's basically causing the patient to cave in. And these are critical situations that we have to have everybody on board to increase the chances of survival with it. So it's truly a team effort. And the thing that pisses me off, it doesn't happen often, but when the communication is broken down, it pisses me off the most, because now that delay of treatment to basically getting that next step of treatment is basically delayed when we're on a clock to basically improve the chances of pretty much this person's survival. We don't know how much time has actually passed before they even activated 911. We don't even know if what the patient is basically telling us is true, or what the symptoms or what our analysis is really accurate, until we get them on the necessary protocols to actually confirm it by the ER physician or the specialist involved in that situation to reverse the situation. By the ER nurse when not taking it serious. And I'm not saying that all of them do it. It's just it's one of those few times that it actually happens. That is one thing that infuriates us paramedics, because you are becoming a problem. You are being a problem that is blocking aid and treatment to the patient that we are trying to save, and you're fucking it up for everybody. Now let's bring it back to the nursing side. And this point right here I'm going to make is EMS is not nursing. So when I talk about respect, we gotta go into the aspect of sometimes EMTs and paramedics basically believe that they know more than the nurse or doctor. And I know it happens on the nursing end too, but like they're in an environment where they can be brought back down to earth, that hey, yeah, calm the fuck down, you have your scope of practice and we respect your knowledge, but you don't really know too much, know as much as us right here, and you are good in your particular area. Stay in your lane. So these EMTs and paramedics that I'm going to basically be referring to are known in the paramedic profession as rescue randies. They're the ones that's extra paranoid about everything. They need to just take a chill pill and just realize that, hey, yeah, you stay in your lane and know your job, and then progress it over. What the physician, once you get the patient to the hospital and what the physician basically says, it's his show. He's running that ER. So if something happens, you already transferred care. It's not on you at that point. So, and from for the nurses that has to deal with this, 9 times out of 10, you're gonna have to. That's when where they tell you in school that you're educating the patient. You have to educate this healthcare professional that just doesn't really know that, hey, A, B, and C is happening, and this is the reason why we're going into it. Because Remember, as a paramedic and an EMT, we know it from the emergency perspective, but we don't know the long-term aspect of why they go through the routes. So that gap in knowledge, the nurses have that, and they can basically provide that to them. It's all about basically being professional, because the rescue Randys are the most annoying people in the fucking world. They're the ones that needs to chill, and paramedics are annoyed with it, and we bring them back down to earth. And sometimes it's just a part of the profession too. We have snob nurses too, but it is what it is. So at the end of the day, you gotta respect both professions. Both paramedic and a nurse are great professions, and they contribute to community, like a community tremendously. Like without them, it'll pretty much be in chaos. So it's all about respect. So like, comment, and subscribe, and I'll see you in the next video. Later.